Noong nakaraang taon, hindi naging madali ang mga hamon na dala ng COVID-19. Nariyan ang lockdown, tigil operasyon ng mga courier services na nagdadala ng mga samples patungo sa mga laboratorio, pagkaantala ng transportasyon, takot ng mga magulang na pumunta sa ospital, pagkakasakit at pagkakalantad sa COVID-19 ng mga empleyado na nagsasagawa ng newborn screening. Sa kabila ng lahat ng ito, hindi naantala ang operasyon ng newborn screening sa buong bansa.
Greetings to all the newborn screeners. Clinical nursing specialty has continued to evolve through the years. Despite the number of nurses who are given the opportunity to go through the program of newborn screening, a few of these nurses participate continuously in the actual newborn screening. Varied reasons are given, and majority falls under the duty schedule concern and the volume of patients that they take care of. What is interesting about newborn screening? Newborn screening is an essential public health strategy that enables the early detection and management of several congenital disorders, which, if left untreated, may lead to mental retardation and/or death. Early diagnosis and initiation of treatment, along with appropriate long-term care, help ensure normal growth and development of the affected individual. It has been an integral part of newborn care in most developed countries for 5 decades, either as a health directive or mandated by law. In the Philippines, its service is available since the year 1996. As per the Department of Health plan, the target objective is that all Filipino newborns are screened, strengthened quality of service, and intensified monitoring and evaluation of newborn screening implementation, sustained financial scheme, and strengthened patient management. The nurses are in unique positions to make a difference every day locally, nationally, and globally for newborns, the profession, and individually. Everyone has the opportunity to do something that strengthens every nurse and make a difference in nursing. Years 2021 have made the nurse to take on a new dimension because of the COVID-19 pandemic. It is so inspiring to see nurses and healthcare team has taken the challenges and risen to the challenge of care. Even with this going on, it does solidify what newborn nurses are called to do to help others no matter the circumstances. As nurses, we all feel that. We are called to help no matter what happens. We go into uncertain situations every day and continue to do our jobs. The bravery of nursing is amazing. Today, every baby can be screened. It is the only way to tell if a seemingly healthy infant has one of these rare but serious congenital conditions. Most affected babies identified through newborn screening who receive treatment early grow up healthy with normal development. Newborn screening nurses of the PGH are passionate and dedicated to the work that they do. They are able to stay motivated during hard times and brush off the little things. This clinical specialty in nursing is challenging and is even more rewarding. Always remember to value what you do and add value by what you do. Happy National Newborn Screening Week to all the PGH newborn screeners.
Good morning to fellow advocates of the newborn screening program. It has been more than 20 years that the newborn screening has been in place. From a modest beginning, the program has expanded to become a national program. Just like anything new, the program experienced a lot of birth pains, but those experiences provided the pathway towards the success it has become. In PGH, I never and will never fail to recognize the work of the nurses group in raising the bar to attain the expected rates that qualified us to be considered successful. After persevering, we eventually hit the 90 to 99% mark to be called a successful newborn screening center. The ingenuity of the nurses in spreading the value of newborn screening and persisting despite all odds were keys to this victory. I would like to emphasize that doing the screening is beyond the call of duty of the nurses. All of them were looking at this as an opportunity to learn and, more importantly, a chance to save our newborns from the ill effects of unrecognized and untreated conditions. I would like to congratulate the nursing division and the nurses newborn screening group for their selfless dedication and perseverance. I look forward to the time that we can go back to our face-to-face celebration, which I am optimistic will occur soon with God's grace. Magandang araw sa ating lahat at mabuhay ang Newborn Screening Group at ang Philippine General Hospital.
Newborn screening is not just a simple task, but our advocacy to save lives. Each year, we dedicate the first week of October as the Newborn Screening Awareness Week. Looking back, PGH has been implementing newborn screening even before its passage as a law in 2004. Dr. Carmencita Padilla has been fervent in institutionalizing newborn screening with the support from our prime movers, the chief nurses, OB and pediatric department, and with the assistance from the Division of Nursing, Education and Training, which led to the establishment of the PGH Newborn Screening Nurses Core Group. Likewise, the core group is also consistent in updating themselves about newborn screening, from the 6 panel tests to the now expanded newborn screening program. We have extended in the service areas, day wards, nursery, and the Department of Outpatient Services. Through the years, the nursing services has been reliable along with the PGH NBS Core Group, who does not distinguish in doing its responsibility whether on official duty or not. We have advanced. Before, we can only screen around 20% of the newborn babies in PGH. But in 2012, with the help of the administration and other stakeholders, PGH has now a 100% coverage. Despite this pandemic, we have been consistent in delivering that 100% of newborn screening. For instance, our nurses in the COVID areas, specifically in OBAS and Ward 15, who, despite wearing hazmat, continually conducted newborn screening. Also worth mentioning is Mrs. Leilani Ipapo of Dinet, who personally delivered the NBS filter cards from PGH to Newborn Screening Center in Quezon City from her own expenses when couriers were barred to make deliveries due to the hard lockdown. Definitely, all of these are consistently achieved with the participation of each one of us. Maraming salamat sa lahat ng mga kasapi ng PGH Newborn Screening Nurses Core Group, sa pamunuan ng PGH at sa lahat ng sumusuporta sa newborn screening. Magandang araw po sa ating lahat.
Tuwing unang linggo ng Oktubre, ipinagdiriwang natin ang Newborn Screening Awareness Week. Ito ay ayon sa Presidential Proclamation 540. Ang linggong ito ay nagbibigay ng magandang pagkakataon upang palawikin ang layunin ng newborn screening, na iligtas ang buhay ng bawat ipanganganak na sanggol laban sa mental retardation at maagang pagkamatay. Noong nagsimula ang newborn screening sa Pilipinas taong 1996, marami ang nag-atubili na maging bahagi ng lokal na pag-aaral ukol dito. Ang Philippine General Hospital ay isa sa mga iilan lamang noon na naniwala na napapanahon nang magkaroon ng ganitong programa para sa bansa. Sa loob ng 25 taon, marami na ang hamon na pinagtagumpayan ng programa. Mula sa pagkakaroon ng batas para sa newborn screening hanggang sa pagharap sa hamon ng pandemya. Noong nakaraang taon, hindi naging madali ang mga hamon na dala ng COVID-19. Nariyan ang lockdown, tigil operasyon ng mga courier services na nagdadala ng mga samples patungo sa mga laboratorio, pagkaantala ng transportasyon, takot ng mga magulang na pumunta sa ospital, pagkakasakit at pagkakalantad sa COVID-19 ng mga empleyado na nagsasagawa ng newborn screening, at pagbibigay ng pangunahing pansin ng mga health facilities sa pagtugon sa COVID-19. Sa kabila ng lahat ng ito, hindi naantala ang operasyon ng newborn screening sa buong bansa. Nagpatuloy ang screening, recall, diagnosis, management, at public education. Sa pagtatapos ng taong 2020, mahigit sa 80% pa rin ng ipinanganak sa Pilipinas ng taong ito ang sumailalim sa newborn screening. Ito ay naging posible sa pagtutulungan ng mga newborn screening centers, regional newborn screening teams ng Department of Health, newborn screening continuity clinics, at newborn screening facilities tulad ng PGH. Dahil sa dedikasyon ng mga doktor, nurses, at midwives, ginawan talaga ng paraan para makarating ang filter card sa laboratorio. Yung ilan dyan, linapitan ang Philippine Air Force, Philippine National Police, Philippine Navy, Philippine Army, at local chief executives. Dahil sa pagsasama-samang ito, na ipagpatuloy ang pagbibigay ng dekalidad na serbisyo sa mga bagong panganak na sanggol saan mang sulok ng Pilipinas. Sa loob ng 25 taon, sa mga hamon at tagumpay, kasama ang programa ng PGH. Naniniwala akong patuloy tayong haharap sa hamon upang maproteksyonan hindi lamang ang ating mga pasyente, partikular ang mga nanay at sanggol, kundi pati na rin ang ating mga sarili bilang mga health workers sa panahon ng pandemya. Siguraduhin natin na lubos na nauunawaan ng bawat magulang ang kahalagahan ng newborn screening na ang maagang paglalapat ng lunas ang dahilan kung bakit maagang isinasagawa ito. Habang tinitiyak natin ang kaligtasan ng mga sanggol, tiyakin din natin na tayo ay ligtas at malusog upang patuloy tayong makaharap sa mga darating pang pagsubok. Ang ating pagsisikap sa kabila ng pandemya para sa mga sanggol sa susunod na henerasyon ang siyang magbibigay ng kahulugan at kahalagahan sa ating pagdiriwang ngayong Newborn Screening Awareness Week. Maraming salamat sa inyong lahat. Mabuhay ang UP-PGH NBS Nurses Core Group.